Voices against corruption. Let the people speak.
Hello and welcome to Primark's public feedback series on corruption, called Voices Against Corruption. And we ask, how do you think corruption affects healthcare delivery in Nigeria?
Actually, our major problem in the healthcare system is misappropriation. And misappropriation is corruption. It's not as if this thing is not put in the budget. It's put in the budget, but the problem is the money is used for something else.
The corruption is endemic because of the fact that people want to enrich themselves. Go to Secretariat now, you want to get the yellow vaccine or yellow card, you have to pay. Somebody has it in bulk in his office, kept somewhere, taken out from the store, giving it out at his own price. And they tell you that it's not available. Madam, if you want it, you can give it at social price. So which means you have to buy it at that because you need it.
Corruption is playing a very significant bad role in our health system. Okay, when you look at our general hospital today, when you look at the facility, it's not as if government is not put effort, put fund into the system to make it functional. But look at it around today. So nobody is planning to go to our general hospital today as far as the poor facility they are.
There is problem in the sector of health delivery in Nigeria. The reason is because in the health department there is really a problem of corruption. And most of the doctors, they have their labs, private labs. If you go there in order to be tested, they will refer you to their own lab outside instead of using the lab in the hospital of the government. That's the major problem that we have. And sometimes they don't used to give you attention while in the government hospital. Until you go to their own private hospital, you will not get their attention. They will give you full attention because they are making their own personal money from there.
Corruption is responsible for the poor health delivery in Nigeria because most of the public hospitals that we have in Nigeria, most of the doctors, the resident doctors that work in those hospitals have their own private hospitals. And most times when government supply or give out materials or equipment that are meant to be used for treatment of patients, they siphon those materials or some of those materials, maybe drugs, laboratory equipment and so on, to their own private hospitals.
When you go to most of the healthcare center, you experience a lot of corruption there, most especially the public sectors.
The bedrock of what we are experiencing in Nigeria today is actually based as a result of corruption, which has led to misappropriation and maladministration of our public hospitals.
Corruption is one of the key factors that is affecting our health service. Some of our stakeholders that are running such firms, such level of organization, they don't tend to deliver what is expected of them. You know, there are good policies, there are good strategies that have been mapped out for the masses, for the benefit of the masses. But you discover some of those leaders that are responsible for managing of such resources don't actually execute what is expected of them.
One abuse of process is corruption. Corruption is not all about embezzling money, shortchanging patients in the hospitals. Not all about non-payment of salary when due. But anytime a process is shortchanged in such a way that what you are supposed to do, you are not doing it, that in itself is corruption.
Poor attention to patients has been experienced in hospitals. And yet, the same doctor could have his own private hospital. And when you go, he gives you a sharp attention. Meanwhile, he's been paid in the government institution to deliver good services, health services. But he doesn't. So it's a corrupt system.
Look at our health system, the health centers, how many of them are working? Our politicians fly overseas to get medical attention and they leave us behind here. They don't even pay attention to what is going on in that sector. So, and these two sectors are very key. You see, the education sector and the health sector, they're very key to national development and all that. So corruption is playing a role there, a very negative role.
Primark's public feedback on corruption in Nigeria is produced with support from MacArthur Foundation.